All right. I'm Limakatso Lebelo. I'm the Senior Technical Officer for ICAP. Currently, I'm working as the Trace Study Coordinator. In Trace, what we are doing is tracking the new HIV positive infections using the new test. That is we are using Asante test in parallel with our country algorithm. So we are able to detect when the person was infected so that we can put in correct measures. So on a day-to-day basis is analyzing the data, going to the dashboard. We have our data and we have a dashboard which reflects our data on daily basis. So we analyze that data and we try to track the trends in new infections. Then we assist the Ministry of Health through the district health management teams to make sure that they address those issues at the facilities. So from 2015 till to date, I have been coordinating different studies, within ICAP, including the minors study at Deba Points of Care, for provision of early TB treatment and retention into care for minors and ex-minors. So basically, that project was geared towards maintaining the minors, ex-minors, and their family members who were diagnosed with TB to maintain them on treatment and make sure that they have good treatment outcomes. So the entry point will be the minors and ex-minors. Once they are screened and diagnosed with TB, we do contact tracing for their family members and anybody who is next to them. And if they are also diagnosed, they were enrolled into program at community level. We had also community supporters who will go to their family members to screen them at their families.
So you've had so much experience working with cross-border or internal migrants. What has been your overall experience with this group of vulnerable populations, and what are some of the challenges that you see that they experience?
Yeah, it's very exciting to work with migrants, but at the same time, very frustrating because of the nature of their work. They are a very high mobile population. So, that being said, you can imagine how difficult it is to make sure that we maintain them on treatment, especially those who are across the border, who are working in South Africa. Normally, they travel on weekends. They come home on Friday and go back to work on Sunday. And the way our health system is designed, we operate from Monday to Friday. So you can imagine that when these miners come home on Fridays, our facilities are already closed. So it was a huge challenge. Even those who are inside the country, because of their movement from one place to another, is still the same thing. It's difficult to make sure that we maintain them on treatment. So we have to work collaboratively with other sectors like the migrant workers associations to make sure that we come up with a workable solution that will help us to maintain these people on treatment, because one of the major challenge was the high defaulter rate. They defaulted treatment and they most of them were lost to follow up. We couldn't trace them because you can imagine the communication across is not very smooth, and we didn't know exactly who to contact if we are looking for a patient. So those are some of the challenges to keep them on treatment. And because of the way we operate, the healthcare system we operate, it was very difficult to make sure that they are on treatment. Now, some of the health facilities, especially at the 3 points of care at Deba, they operate on weekends, for instance, on Saturday, to allow those miners who traveled from South Africa to access healthcare services on Saturday when they come home on weekends. So I think that was a huge step in the right direction to make sure that they are maintained on treatment. Another thing that was changed in our guidelines, I think it was the issue of multi-month prescription. If a patient is somehow stable, or adherent to treatment, taking their medications well. They were given a multiple month treatment so that even when they traveled, they are still on treatment. And we devised another strategy whereby they were collecting each other's medications. If one of them sees that this month I will not be able to go home, they give their health booklet to the ones who will be able to come home so that they collect their medications, and we educate them as expert clients so that they know how to instruct them to take medications well and to assess them for any possible side effects.
What are the challenges in terms of making these changes?
Yeah, the most difficult thing is mobilizing resources to make sure that these changes happen. For instance, making people work on Saturdays is an extra day, so it means we have to come up with a plan to address that. And giving people multi-month prescriptions, it means our supply chain should be prepared for that. That's where we were finding difficulties that in our pharmacies will be told that we don't have enough drugs to give one patient for 3 months or for 2 months. So slowly but surely we are getting there, but change is never something that is easily accepted. It takes time.
You mentioned the importance of collaborating with other sectors, and you also mentioned things like working with the Minister of Health. Are there other sectors that you work closely with that is important to the work?
Yeah, like we have Migrants Workers Association and ex-miners associations, and even the mining houses in South Africa. We are collaborating with them so that because they have like mini health facilities in their mines. So when we have a patient, we come to an agreement with the patient that we notify his or her mining houses in South Africa so that they keep an eye on him or her to assist with any health issues or any side effects that can come up while he is on treatment before he comes back to his or her appointment back in Lesotho. So that's how we normally collaborate. Yeah, and the Migrant Workers Association and Ex-Miners Association, we are mainly working with them on demand creation and support to make sure that these people, they are aware that there is help for them. There are systems in place to help them to be able to access health care services easily and to be able to maintain their treatment. So they help us with demand creation and psychosocial support for them and their families.
Oh, is there anything else you wanted to add that you think is important for us to better understand this group and the challenges they face?
I think one other thing that we still don't know yet how to address it is the kind of stigma they face in the mines. Most of them, they don't want us to disclose to the mining houses that they are taking treatment because they fear loss of their work, even if they are still feeling fit and healthy after starting treatment. Just because they've been diagnosed with TB or maybe had TB and HIV, they are afraid that their bosses will let them go.
But what do you think is the right way to approach destigmatization?
What can have an impact is approaching them through the workers associations, because definitely they will be first to listen. And if we collaborate with the workers association, and as healthcare workers we try to educate the supervisors and show them the pros and cons of having a worker who has fully disclosed to them as opposed to a worker who has not disclosed what it means to them, I think maybe, just maybe, there can be a change. Because having a worker who is not fully disclosed, it puts them also at risk of getting infected. But if this other worker has fully disclosed, they will take precautions and make sure that prevention and control measures are put in place. But if they have not disclosed, they are all at risk of being infected. So I think coming up with such a strong argument and showing them the pros and cons, but going through the workers' association can only have an impact.
Thank you so much for everything you share. I learned so much from this.
Thank you so much, Angela. I think I don't have anything else to add. I'm just excited to have had this discussion with you.